Alright, hi, my name is Aloysius Del Rojo. I'm a student nurse here at the University of Guam. And today we're going to be performing a head-to-toe assessment, okay?
Yes.
Alright, can I just see your wrist for verification, please? Alright, can I have you state your name?
My name is Ashish Del Rojo.
And your date of birth?
My date of birth is October 3, 2005.
Alright, good job. So what are you here for today again?
My head-to-toe assessment.
Alright, so for your head-to-toe assessment, I'm just going to ask you some questions first, okay?
Yes.
Taking a little bit. Alright, can I just have you state your name again?
My name is Ashish Del Rojo.
Alright, what time is it?
It's 9 o'clock.
Where are you?
I'm at my house.
Alright, and who's the President of the United States?
Trump.
Okay, I'm just going to ask you some questions as
Yes.
well beforehand about your current history,
Mhm.
medical history, okay?
Yes.
Are you taking any medications?
No.
No medications? Any allergies?
No.
Any trauma?
No.
No? What about any surgeries or serious injuries?
No.
No? Okay. I'm just going to ask some family questions now. Do you have any family chronic, history of chronic illnesses in the family?
No.
No? Okay, what about any smokers or drinkers in the family?
My dad used to smoke.
Alright, what about diabetes?
My dad is pre-diabetic.
Okay, alright. Now also before we do start it, I'm just going to ask you some general questions as well, okay? Are you experiencing any headaches?
No.
Any blurriness with your vision?
No.
Ringing in the ears?
No.
Any random nosebleeds?
No.
No. Any random sore throats?
No.
No. Any shortness of breath?
No.
What about chest pain?
No.
No. Constipation, diarrhea?
No.
No. Any problems with urinating?
No.
And pooing?
No.
No. Do you have trouble sleeping?
No.
Any sudden weight loss?
No.
No? Okay, alright, so that's good. So before we do start the head-to-toe assessment, I'm going to assess for your vital signs
Yes.
first, okay? So after that, I'm going to check his height and also his weight as well. And then I'm going to be performing the vital signs. Alright, so first I'm going to be checking your pulse. Alright, so first you would check the pulse for 1 whole minute. And then after that, you would check the respirations for another minute as well. And then I would be taking the temperature as well, but I don't have the thermometer, so I would be going straight into blood pressure. So for the blood pressure, you would check his baseline first. Alright, so I'll be checking his baseline. Alright, so his baseline is 110, so I would go 30 above that to check for his blood pressure. Okay, are you okay? Alright. Release. Okay, now I'm going to be checking for your blood pressure now, okay? So his blood pressure is 110 over 80, and that's a normal blood pressure. Alright, good job. So now we can perform the head-to-toe assessment, so we're going to start with the head first. Alright, so first you would assess the scalp. I'll just lift this up a little bit. So you would check the head, you would check for any lumps, any cuts, lesions, masses, infestations. Alright, good. Alright, and then now I'll check the temporal. Any pain?
No.
No? And now I'll check the sinuses. Any pain?
No.
Any pain?
No.
No. Alright, now I'm going to be checking the eyes. So first I'll just check his reflex. So you should see the pupil dilate. Okay. Alright, and then now I'm just going to assess his eyelids. Alright, and then now you would look at the eye. You would want to look at the sclera, the iris, the pupil, and then also you would pull down to check his conjunctiva. Alright, everything seems good. No pain in the eyes,
No.
right? Okay, now I'll be checking his ears. So can I just have you turn around? So first I would check the helix of the ear, see if there's any redness, no redness, and then I would palpate the tragus, and then the mastoid process, any pain?
No.
No? And then you would repeat on the other side, assess for any redness, inflammation, any pain?
No.
No? Palpate, any pain?
No.
No? Alright, good. And then now we would be moving on to the nose. Alright. So I'm just going to be checking your nose, okay?
Mm-hmm.
I'm going to see if your septum is deviated. No, everything seems to be fine. Alright. Now can I hold you, have you hold one nostril and then blow out? And then the other side? Alright, so it seems to be cleared out. Alright, now I'm just going to assess your lips. Okay, no cuts, no sores. Alright, can I have you open your mouth now? Alright, stick your tongue out. I'm gonna be checking your inside of your cheeks. Okay, I'm gonna be checking the palate, hard and soft palate, and then your uvula. And then can I have you stick your tongue upwards? Alright, and check inside. Can you lift, move your chin down, please? Alright, and then check the teeth and the gums, see if there's any cavities or any problems with the gums. No, everything seems to be fine. Alright. Nice. And then I'm just gonna feel for your temporomandibular joint now, okay? Alright. And then can I have you open your mouth? Alright, so there's no grinding, no crackling. Okay, that's good. No pain?
No.
Alright. Now we're just gonna check the cervical spine. So to do that, we're just gonna do some range of motions. Okay. So what I'm gonna have you do is, can you extend your head, flex, down, one more time, rotate to the right, left, right, left. Okay, and then can you shrug your shoulders up? One more time. Keep on. Okay, good job. Now we're going to be assessing the cranial nerves. Okay, so we don't do cranial nerve 1, so we'll go straight into cranial nerve 2, which is the optic nerve. Can I have you close one eye, please? Alright, tell me when you see the object, okay? Alright, other eye. Okay, good job. Now we're going to be checking for cranial nerves 3, 4, and 6. Okay? So for this one, I'm just going to have you follow the pen light, okay?
Alright.
Don't move your head, okay? Just follow with your eyes. Okay, good job. Alright, now we're going to be assessing cranial nerve 5, which is the trigeminal nerve. So can I just have you open your mouth against the resistance? Alright. And then I'm just going to feel your masseter muscles, okay? Okay, any pain?
No.
No? Okay. Now we're going to move on to the 7th, which is the facial nerve. Can I have you raise your eyebrows and then frown, smile, puff your cheeks? Okay, good job. Now we're going to go to the 8th one, which is the vestibular cochlear nerve. So I'm just going to whisper, okay? And then you're going to...
Cat dog.
Alright.
Cat dog.
Alright, good job. Now we're going to do 9 and 10. Alright, so can I just have you say, ah?
Ah.
Alright, so I'm going to check the uvula. Ah.
Ah.
Alright, and then in order to check this, we need to do gag reflex. I don't have the spatula with me, so I'm just going to pretend that you have your gag reflex, okay?
Ah.
Alright, good job. Now we're going to do the 11th, which is the accessory nerve. So I'm going to have you shrug. Okay, one more time. Alright, good job. And now we're going to do the last cranial nerve. So that one, all I'm going to have you do is stick out your tongue, move it side to side. Alright, good job. And then you can stop now. And then can you say tight,
Tight.
light,
Light.
dynamite.
Dynamite.
Alright, good job. So that ends the cranial nerves. Now we're going to be assessing the neck and then also the precordium. Okay? Alright, so for this one I can just check over here already. I'll just look at your jugular veins. Alright, over here. Seems to be good. And you can also palpate the trachea. Okay, everything seems to be good. And then we're going to be also inspecting the precordium, so that's just the area around the heart. Alright, so this would be aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Can I have you take off your shirt now? We're going to do some palpating now. Alright. Now we're going to be assessing the precordium. Okay. So first I'm just going to inspect, okay?
Yes.
So as I said before, this is the aortic, pulmonic, Erb's point, tricuspid, mitral. Alright, now I'm going to assess your apical pulse. So your apical pulse, you can just find it right over here, the mid, right at the apex, right over here. So I can feel it over here. Alright. And then, after that, okay, pause, I don't know what's next. Shit.
Okay, I'll space too.
Alright, now can I have you lie down? Alright. So for this one, we're going to be checking the hepatojugular reflux now, okay? Alright, so for this one, I'm going to be pushing over here, okay? And then I'm just going to be observing your jugular veins, okay? Alright. Alright. Okay, other side. Okay, good job. Oh, it's so hot. Okay, now can I have you sit up? We're going to be checking the symmetric expansion. Okay, you face me. Okay, so we'll do the front first. Okay? So just breathe in for me. Okay. Alright, turn around please, and we'll do the posterior side as well. Breathe. Alright, good job. Can you face me again one more time? Now we'll be observing for a tactile fremitus. Alright, so I'll just do... oh, actually, can you face back one more time? I'm so sorry about that. Can I have you say 99?
99,
Alright.
99, 99, 99, 99, 99.
Alright, face me again. Okay. Same thing.
99, 99, 99, 99, 99.
Alright, good job. Can I have you turn around? Now we're going to be percussing the posterior lung fields, okay? Alright. Alright, other side. Alright, good job. Now I'm going to be checking for diaphragmatic excursion. Okay? So take a deep breath. Okay, hold. Alright, take a deep breath. Hold. Alright, so right over here. And other side. Hold, take a deep breath. Alright, release. And take a deep breath. Alright, so just about the same over here. Okay, now I'm going to be checking his costovertebral angle tenderness. Okay, so right over here. Stand up straight, please. Tell me if you feel any pain, okay? Any pain?
No.
No? Any
No.
pain? No? So this one is just to check if there's any pain, you would feel it in kidneys. Usually it's a sign of like a kidney infection. Okay? Alright, so now I'm going to be starting the oscillatating. So can I have you lie down again? Alright, so I will be oscillatating the carotid arteries. So using the bell of the stethoscope, I would be doing the carotid arteries, okay? And this is to check for any bruits. Alright, good job. Can I have you sit down now? I'm going to be checking your heart sounds and lung sounds as well, okay?
Yes.
Okay. So we're going to be doing the heart sounds first, okay? So, aortic valve, pulmonic valve, Erb's point, tricuspid, mitral valve. Okay, and then for S1, I'll be using the bell and I'll be listening at apex. Alright, now for the S2 sound, I'm going to be using the diaphragm and it's going to be on the pulmonic valve. Alright, sounds good. And then now I'm going to be checking lung sounds in the anterior portion of the body, okay? Breathe in. Deep breath. 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 Alright, can I have you turn around now? I'll be listening to the posterior lung sounds. Alright. Deep breath. 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 Alright, good job. Okay, you can turn around towards me now. So now we're going to be checking the upper extremities. So for the upper extremities, we're going to start with the shoulders and we're just going to do some range of motion, okay? Just lift this up a little. Okay. So first, we're going to do flex. Okay. And back. Flex. Back. Okay, other side. Flex. Put back. Flex. Put back. And then abduction, adduction, abduction, adduction. Alright, other side. Alright, good job. Now we're going to move to the elbows, okay? For the elbows, same thing. Flexion, extension. Flexion, extension. Other elbow, flexion, extension, flexion, extension. Alright, and then the next exercise for your elbow, what I'm going to want you to do is pronation and supination. Okay, so what you're going to do, pronate, supinate, pronate, supinate. Alright, good job. Now for the next one, I'm going to be assessing his hands and his wrist. Okay, so can you shake my hand? Alright, other hand. Okay. Alright, and then can I have you push against my hand? Okay, good job. Now I'm going to be observing the hands, okay? So assess, okay? Now I'm going to be checking for capillary refill time, okay? So it should be less than 2 seconds, it should return already. Okay. Okay, good job. And everything seems to be fine. Any pain that you're feeling?
No.
No? Okay, alright. So now we're going to be assessing the reflexes in the arm, so that includes the triceps, the biceps, and as well as the brachioradialis. Okay. So can I have you relax your arm, okay? Relax your arm. Ready? This is the triceps. Okay. Now we're going to do the brachial, the biceps. Okay. And now the brachioradialis, okay? Okay, good job. Now we're gonna do the next hand, okay?
Mm-hmm.
So the same thing, relax. Let it be. Okay, and now we're gonna do biceps. Okay, and then break your radius one more time, sorry. Okay, alright, good job. So everything seems to be fine. So now we're gonna be assessing your abdominal region. So you can lie down. And also, I'm just gonna be checking your radial pulse. Okay? So can I just check it? Okay, other side. Okay, good. Alright. So I'm gonna be inspecting your abdominal region first, okay? So I would look at the abdominal contour, assess the skin, see if there's any bruising, edema, everything seems to be fine. Check the umbilicus region, and then also check for aortic pulsations. Okay, everything seems to be good. Now I'm going to auscultate bowel sounds. Alright. Alright, everything seems to sound normal bowel sounds. And now I'm gonna be percussing on the abdomen now. So first, alright, good job. Now I'm going to check liver span, okay? So for liver span, I'm going to start over here. I'm going to percuss. Alright, so over here, and then lower. Alright, over here. So liver span is just right about there, okay? Alright, so now I'm going to be starting light palpation and deep palpation of the abdomen, okay? Alright, so first I'm going to start with light palpation, okay?
Mm-hmm.
Any pain?
No.
Okay. Alright, now I'm going to start deep palpation, okay? Tell me if you feel any pain, okay?
Mm-hmm.
Any pain?
No.
Alright, now I'm gonna be palpating for the liver now, okay? Alright, now for the spleen, I'm gonna palpate the spleen. Alright, now I'm gonna palpate the aortic region. So aortic, you would find the middle over here, and over here, and gastric. Any pain?
No.
Alright, and then now we will be checking Murphy's sign. So Murphy's sign, you will find the last rib cage. Take a deep breath. Alright. Release. Any pain?
No.
No? Alright. Good job. And then last, we were gonna check for rebound tenderness. Okay. So I'm gonna be deep palpating and then I'm gonna release really fast and let me know if you feel any pain, okay? Any pain?
No.
Any pain?
No.
Any pain?
No.
Oh, alright, good job. Alright, so that finishes up the abdomen area. So now we're gonna move down to the lower extremities. So you can lie down first. So now I'm just going to be assessing your legs, okay?
Mm-hmm.
Alright, so I'm going to be looking for any edema, bruises. Everything seems to be fine. Okay. Alright, now I'm going to do the iliopsoas muscle test. So I'll start with this leg. Can you flex first? Lift up. Okay, other leg. Okay, alright, so for the iliopsoas muscle test, I'm going to have him lift it up, outwards, and then I'm going to put my hand over here. I'm just going to move it towards me. Any pain?
No.
Alright. The other side. Lift up towards me. Over here. Tell me if you feel any pain.
No.
Good job. Alright, now we're going to do the obturator test. So for obturator test, I'm going to have you move at a 90-degree angle. And then I'm going to rotate it laterally. Alright. Any pain?
No.
And the other side as well. Any pain?
No.
Alright. So everything seems to be good. Alright, now we're going to be checking for the bulge sign. But first we're going to have him flex and extend the knee. Okay? So can I just have you flex your knee? So flex it. Flex it. Extend. Okay. Other one, flex. Extend. Okay. And then the first one we're going to check is ballottement of the patella, okay? So what we're going to do is okay. And the other side. Okay. So ballottement seems to be good. And then now we're going to check bulge sign. Okay. And I'm just going to be observing the patella one more time. Okay. So ballotment. Okay, rises. Okay, good job. Now we're going to move on to the next one. So the next one, I'm going to be performing the McMurray's test. So for McMurray's test, I'm going to have you move this here. Okay. And then I'm going to have you rotate outwards. Okay. Alright. One more time. Inwards. Okay. Next one. Up, same thing. Inwards. Alright, one more time. Outwards. Alright, good job. And then now I'm going to be checking the reflexes of the knees now, okay? So I'm going to be using the neurological hammer. Okay. But before we do this, I'm going to be checking his plantar and his dorsiflexion, okay? So plantar flexion, dorsiflexion, plantar, dorsiflexion. Okay. So first I'm going to be checking the patellar reflex. Okay. So lift up your knee just a little bit. Okay, one more time. Okay, other one. One more time. Okay, good job. Now I'm going to be checking the Achilles reflex. Okay. How do you lift this one up? Okay. Okay, one more time. Okay. Next one. Lift it here. Alright, for the last one, we're going to be doing the Babinski test using this end of the hammer. right. Okay. Alright, good job. So now we're going to be checking the pulses in the arteries of the lower extremities. Okay. So first I'm going to be checking the femoral artery. So I'm going to be touching you over here, okay? Everything's okay so far? Okay. Okay, now we're going to check the popliteal. Okay, and now the posterior tibial. Okay, and now the dorsalis pedis. Alright, good job. We're going to be checking for balance, and that will be the last one. Okay, so can I have you stand up, please? Okay, so for this one, I'm going to be checking your balance, okay? Alright, so first can I just have you, so we're going to be assessing your finger to nose, okay? So I want you to touch my finger and then touch your nose, okay? Go. Faster. Other hand. Alright, good job. Okay, now I'm going to be checking a balance test. Okay, so can you just lift your leg up? Okay, other leg. Okay, alright, now we're going to be doing a Romberg's test. So for Romberg's test, I just want you to hold your arms like this, okay? Okay, with your eyes open, stand straight. Okay, good job. Okay, now release. And now I'm going to want you to do it again, but this time close your eyes. Okay? Alright, so it seems to have good balance, okay? Alright, that's good. So now the last one we're going to be doing is checking his gait, so his walk. So I'm just going to have you walk, okay? You can walk straight. And then walk back. And one more time. Walk back. Okay, and then you can have a seat. Alright, so after that, that would be the end of the stuff, and then hand hygiene would be the last step. And then, so thank you so much. Alright, that's good. End of the head to toe assessment.